Mark Poole answering the question, how long does it take to recover from bypass surgery? The answer is, it depends. It all depends on the strength of the patient, age of the patient, how the patient does with the surgery, and factors such as that. But to give you some general guidelines, when we talk about bypass surgery and recovery from bypass surgery, it doesn't depend so much on how many bypasses were done. I think patients are more concerned if I tell them they need quadruple bypass rather than one bypass. And of course, it does seem more significant to have more bypasses done. It takes a little bit longer. In general, each particular bypass takes about 15 minutes or so. So it's not that a quadruple bypass takes 4 times as long as one bypass. It's just maybe 45 minutes longer, at least in my hands. It's more the process of going through the operation at all, of having your heart fiddled with, touched, and manipulated, having changes made to your heart, if you will, and also going through a sternotomy. I do on rare occasion do a robotic form of bypass with small incisions off to the side, but I can only do one bypass that way. Multiple bypasses, I generally have to use a sternotomy. So going through that process, it's usually 4 or 5 days in the hospital for most patients, and then they go home. Some patients go to rehab, of course. Those are typically older patients, patients that have difficulty walking and that sort of thing. So within 4 or 5 days, most patients are back home again. They're walking. They're free to walk as much as they want or can. Usually within several weeks, they have a lot of improvement in their stamina and how far they can walk, how long they can walk. Some patients are walking a mile a day, 2 miles a day. I've heard of patients walking 5 miles a day. Some patients tell me that. So through that process, they're getting stronger, they're feeling better, more energy. Then we usually have patients doing cardiac rehab 3 days a week. They go to the rehab facility, have a physical therapist working with them, building strength and mobility, but also being careful with the chest not to injure anything. At about 2 months, I consider the patient healed in terms of the bone. It's back to about 99% of original strength, I would say. And at that point, they're released to any and all activity. From my point of view as the surgeon, they can start lifting weights, start more vigorous activities, especially with the upper body. And yet we still continue cardiac rehab through that process just to help the patient. It's like having a personal trainer. So cardiac rehab generally lasts about 12 weeks, which some younger patients may graduate early, not really need it anymore, get as much out of it. Most of the older patients will continue it through its full span. And so it's hard to say for a given patient how long it takes to get over the surgery. Generally, younger patients will bounce back quicker, be able to be back to full and unrestricted activity maybe a little bit quicker. Older patients may take a little bit longer. It's generally a bell-shaped curve. I generally think anything that's human-related, it's a bell-shaped curve. You have some people very quick, some people very long. Most people are in the middle with an average rate of recovery. And so, you know, for most patients, 2 to 3 months, they're kind of over the surgery. You may occasionally find somebody that tells you it took them a year to get over the surgery. Obviously, I'm not in a position to question that for that patient, but that is much, much longer than it takes for most patients. I've had some patients claim that within 2 to 3 weeks, they were back to doing most things. So it's kind of all over the map. For most patients, 2 to 3 months is the time it takes to get over bypass surgery. And yet it also depends on exactly what you mean by being over it. If it's a return to full function, to work, activities, exercise, and so forth, that's a different thing than meaning never have a ache or pain or occasional twinge of something. That would take much longer. So for most patients, it's reasonably straightforward and quick recovery. I hope that would be true for you.